Well, joining us now is Professor Zhiwei. He's a public health expert from Nanjing University's medical school. He joins us from Suzhou over the phone. So first off, just your reaction to the comments from Dr. Redfield. He's a long-time, health official working in the health industry for many years, saying that it's possible this virus leaked from a lab in Wuhan, although many people have dismissed it. Your thoughts?
Well, actually, most of the scientific community does not believe that this virus originated from research laboratories. I think in February, the WHO multinational team did a rather comprehensive investigations in Wuhan. Basically, they went through all the lab records and how the lab was managed, and basically through the hospitals and the wet market. Their conclusion is, I think it's pretty clear to me that this virus is unlikely originated from a research lab, and it's more likely actually coming from other sources. Basically, we have plenty of evidence that the virus are likely coming from the wild animal and through intermediate animal species transmitted to humans. I think this is something actually we have to bear in mind, that this investigation is quite comprehensive, thorough, and conducted by a few of the experts.
Well, one point that Dr. Redfield also made that many other experts do agree on, including Dr. Fauci, is that this virus was possibly circulating a lot longer than we first known, possibly months in advance. Do you see that being the case?
I think that definitely there is a possibility for that, and we do have some preliminary evidence that the virus actually emerged earlier than what we thought, such earlier than December 2019 in Europe and in the States as well. And so this actually is an indication that the virus actually may have circulating in a kind of a low, frequency manner in some populations for some time. So definitely this is the case. But I think to have a conclusive a view on that, we need to have a more kind of international coordination and looking at those different sporadic reports to see whether those events are indeed what we think is that the virus has been existing for some time.
And yet, Professor, the question remains, where exactly did this virus come from? Do you think we'll ever get a clear answer to that?
Well, actually, finding the origin of the virus is always a very complex and time-consuming task, and often I think you will be disappointed that we can't really come down or pin down where exactly it came from. But for the best, what we could do is that we rule out where it came from instead of simply pin down, because often our experience is that when you think you found the origin and new evidence emerges saying that it came from some other sources. A good example for that is the HIV. People thought in the early days that they thought they knew where the virus originated. They think they identified the patient zero, but after a few years later on, they found another case happening even earlier. So we have to be really cautious in terms of saying where the virus came from, originated from.
All right, Professor Zhiwei.